Hello, everyone. Welcome to this year's virtual Majors Fair hosted by Career Services. We are very excited that you are participating with us. Before we get started, I would like to go over a couple of things. All those that are participating, you are only in listen mode only. If you have questions for our presenters, please put them in the question and answer area on Zoom. At the bottom of the page, you will see that. And you can also put questions in the chat. We do have two advisors from Allied Health, Marilyn Goff and Katie Witcher, if you have questions for them as well. Our first presenter this evening is Penny Stack, who is the program director for OTA, Occupational Therapy Assistants. So Penny, I'm going to turn it over to you.
Thank you, David.
You're welcome.
Hi, everyone. Thank you for being here. I'm really excited that you are exploring allied health professions. Occupational therapy is a really fun career. You have the opportunity to work with individuals throughout the lifespan, from birth all the way up to old elderly age groups. And so with that said, you also get to work in a variety of settings. You can work in places that are really fast paced, like a hospital, or maybe more intimate and one-on-one in home health, or maybe rehabilitation. You really get to know your patients. You can use activities that are meaningful to your patients. And so your treatment plan is as endless as your creativity, which is one of the things that I really love about occupational therapy. I think in my career personally, just to kind of share with you how a career can ebb and flow, is I've worked in skilled nursing facilities, hospitals, I've worked with school-age children, home health. I now teach in academia. I've worked in community reentry. And then there are also some non-traditional settings that you may want to consider when exploring occupational therapy. For example, you could consult with a theater group in helping them adapt a presentation for children with special needs. Or maybe you can work with a home builders association in adapting homes for people who may need homes modified so they can age and live in place at home. So it's just so vast. And one of the really neat things about occupational therapy is that you do not have to go back to school to do something new and exciting in your career. You can maybe just change areas of expertise. So with that said, I'd like to draw your attention to the catalog page on the Tulsa Community College website, where you'll find a lot of information about applying to the program. As you scroll down on this page, you'll see the requirements for applying would be a GPA of 2.8, an ACT score of 18. Right now, there are 3 prerequisites to apply, but we are going down to 2. You will only need to have medical terminology and applied anatomy, which are also prerequisites for other programs. So that can help you kind of explore other areas that you may be interested in as well. We have an applicant ranking scale that we use to rank all of our applicants, and you can see here that you will earn points based on grades, also GPA and ACT score, any life experience you may have had doing customer service or working in rehab, and this helps us objectively measure who would be a well-rounded good candidate to come into the program. We're looking for somebody who can really connect with people and also somebody who is academically strong. We do require a background check, and we do require a drug test because of all of our partners that we do field work in the community. A starting salary for somebody who is an occupational therapy assistant will be anywhere from $35,000 to about $50,000 a year. So it's a really good return on your academic investment. And like I said, you can work in a variety of settings, and you can also travel with this position and go all over the world. You work with a team of other healthcare providers, such as physical therapists, speech language pathologists, nursing, respiratory therapists, radiologists, all different types of specialists. So you are a part of a team and you get to collaborate on doing what's best for your patient. So if you have any additional questions, I really encourage you to reach out to me. My email, I'll write it in the chat as well, is penny.stack@tulsacc.edu. I really enjoy meeting with students one-on-one to answer any of their questions about the program, and I would enjoy an opportunity to meet with you as well. So David, that is all I have if we are ready to move on. Thank you.
Thank you, Penny. Thanks for that information. The next presenter is Megan Cottom from the Pharmacy Tech Program. So take it away.
Hi, my name is Megan Cottom. I have been with the Pharmacy Tech Program for several years now, and I love doing the Majors Fair. Our Pharmacy Tech Program is a 16-week course. We usually come in all day Mondays and all day Wednesdays. There are no prerequisites for our courses. We have a state-of-the-art lab. In the lab, we will train you on doing retail pharmacy. We also do compounding. We make suckers. This semester we're going to make dog treats. We make suspensions. We make creams, gels, ointments. I'm trying to think of all the things that we make in there. So that's our compounding lab. And then we also make IVs. Our students this semester just got finished making IVs, and you guys come in and you guys are the ones that put the medication in the IVs. That's what technicians do in the hospitals. In the hospitals, technicians take the drugs to the floors. In our program, you get 16 credit hours towards electives. And with those 16 credit hours, not only do you have labs that you go out to clinical rotations. So you get to go and see which part of pharmacy you like the most, whether it be a retail setting like Walgreens or Walmart or CVS or any of those, or whether you would rather be in a hospital setting like Hillcrest or St. John's or St. Francis. We also have an infusion pharmacy that I'm sending students to this semester. I think that's about it about our program. It's a pretty fun program. I teach the professions class. I love teaching the compounding, and I'm also the clinical coordinator for the program. If you guys have any questions of me, my email address is megan.cottom@tulsacc.edu. And the director of our program is Teresa Foster. So if you want to ask direct questions to her, her email address is teresa.foster@tulsacc.edu. Thanks. I'm going to give it back to you, David.
Thank you very much, Megan. Thanks for that information.
Thank you.
Now I'm going to turn it over to Amy Francois, who is over our DMS program, Diagnostic Medical Sonographer. Take it away, Amy.
You're muted, Amy.
Yeah.
So sorry about that. And it's not the first time today that it's happened. But my name is Amy Francois. I'm Program Director for the DMS program at TCC. The Diagnostic Medical Sonography program, we use high-frequency transducers to produce images of soft tissue in the body and blood vessels in the body. We don't work alone. We're part of a healthcare team, and in particular, we work with the sonologist, the one who's going to be reading to the physician. We provide one-on-one care to our patients. Those patients might be healthy or they might be critically ill. We're often found in the emergency room, in the operating room, at the patient's bedside. We take our ultrasound machine and we can travel all over the facility. Due to our close contact with the patients, sonographers are at increased risk for contact with those who have infectious diseases. We are committed to lifelong learning because all medical professions are rapidly growing, so we have to be willing to continue our education even after we leave school. We work in a variety of medical settings such as hospitals, clinics, doctors' offices. Our median pay for sonographers is about $25 an hour here in the Tulsa area. Full-time sonographers earn around $52,000 a year here in Tulsa. Our career outlook looks really good. According to the Department of Labor, we are expecting about a 12 to 15% growth in sonography over the next 10 years. Right now, this data is really accurate for the east and west coast of our United States. That's where a good majority of our jobs are. Here in Oklahoma, the job market is a little tighter, and positions are going to those who are more experienced and those who have credentials in multiple areas of specialization. In sonography, there are lots of areas of specialization. And here at TCC, we teach 3 of those specialized areas. We teach abdominal ultrasound, OBGYN ultrasound, and vascular ultrasound. The DMS program is a 5-semester program excluding prerequisites. It is full-time. It is very difficult to hold a job while in the sonography profession, in the sonography program. We're located on the Owasso campus. Class and lab is here, but our clinical education is off campus. And those clinical sites can be a distant travel. They can be up to 2.5 hours one way in travel. So a student would have to travel 2.5 hours to that clinical site, have their 8-hour shift there, and then travel 2.5 hours back home again. DMS students graduate with an associate's in applied science. And because we are an accredited program, our graduates are eligible to sit for national board exams. To be eligible to apply to the DMS program, applicants need to have a minimum GPA of a 2.5, although a 3.5 is going to be better for competition with other applicants. You need to have a minimum composite ACT score of an 18, but again, to be competitive, that ACT composite really needs to be a 23. And then there are 4 prerequisites that we require be completed before you can apply. And they are freshman composition, pre-calculus or college algebra, human anatomy and physiology with a lab, and a physics class. Applicants are scored based on that criteria I just mentioned, and then the top 21 applicants are invited to come in for the professional interview. That professional interview has multiple components to it, and we score each of those components. And then at the end, we add all of those scores together, the pre-interview score and the post-interview score, and those who have the highest score are invited to start the program. We typically have 85 to 90 qualified applicants, and we only accept 14 of those. So the DMS program is very, very competitive. Typically, those who get accepted into the program have a really high ACT, have a really high GPA, and have high grades on all 4 of those prerequisites. So thank you so much for your time. I appreciate you coming and spending some time with us today.
Thank you, Amy. We appreciate that information. Now I'm going to turn it over to, I believe, Laura. You're going to show some videos
Yes, I'm going to show
allied health programs that we have.
Yes, give me just a second and I'll get it started.
Thank you.
Hi. Hello.
Hi.
Hi.
Hi. Hi.
Hi. Check out.
Hi.
Are you ready to be a healthcare superhero?
Congratulations on your decision to pursue a career in allied health.
Hi, I'm Dr. Melanie Heffington. I'm the program director for the TCC Physical Therapist Assistant Program. Physical therapist assistants work alongside physical therapists in the delivery of exercise as medicine to individuals across the lifespan. Physical therapist assistants work in lots of different settings to include school settings, home health, hospitals, inpatient rehabs, nursing homes, and outpatient clinics. Our PTA program here at TCC is 5 semesters, at the end of which a student earns an Associate of Applied Science and Physical Therapist Assistant and is eligible to sit for the National Licensure Exam. My email is melanie.heffington@tulsacc.edu. If you have any questions or would like to visit with me virtually, I'm more than happy to set that up. Thank you.
Hello everyone, welcome to Smart Start. My name is Rachel Osberg and I am the Program Director for the Dental Hygiene Program here at Tulsa Community College. I would love for you to join us for our breakout session time together so that you can learn a little bit more about the program. Please bring any and all questions that you might have about not only our program but the dental hygiene profession itself, and we will be happy to answer those. A few little key points about our program. We are a 2-year program housed at Metro Campus only. Typically run Monday through Friday, 7:30 in the morning to 5 o'clock in the evening. Our curriculum is a set curriculum. It's sequenced in a specified order, so we cannot modify it based on a student's individual needs. There's not much flexibility there. Our graduates do graduate with an Associate of Applied Science, and upon graduation and licensure, they earn somewhere in the ballpark of $325 a day, so very rewarding. Not only is it financially rewarding, but the dental hygiene profession itself is fulfilling personally as well. We are unique in that we get to spend a lot of time with our patients, usually from the time that they are itty bitty, growing through until their elderly years of life. Not many healthcare medical professions get to spend that time with patients like we do. If all of that sounds like something you're interested in, I would love to see you at our breakout session. Stay well.
Hi. My name is Lori McMichael. I'm the Acting Program Director for the TCC Radiography Program. This program has changed my life. I started my radiography program here by attending the 2-year program and passing my registry with the ARRT. After that, I've been able to work in areas like diagnostic, education. I've worked with students. There's just so many opportunities once you get your radiography certification. You can be trained on the job. You can work in CT, you can work in MRI, you can work in a cath lab, you can work in mammography. So there's areas that you can pursue that are specialty areas. This is a fantastic career. I hope you choose to apply to our program. It is competitive to get in. We normally choose 30 students out of anywhere between 150 and 200 applications each year. So get those general ed courses done and come join us in the radiography program. If you have any questions, please email me. I'd be happy to answer any of your questions and talk to you about our program. Thanks. Bye-bye.
Hi, my name is Teresa Foster. I'm the program director here at the Tulsa Community College Pharmacy Technology. Welcome to our hospital lab. Pharmacy technicians are essential workers. Pharmacy is integrated into every part of the healthcare system, and we believe our students need a strong foundation. We believe in simulated skill work. We make sure that our students are ready by the end of 1 semester to take the national certification. We are the shortest pharmacy technician program here in Tulsa, and we're also probably the oldest technician program here in Tulsa. And we believe that our students should meet the quality that is required out there and that patients deserve. And so we do a lot of simulation, we do a lot of one-on-one, hands-on, to make them feel like they're out there in that environment. Our program is 1 semester, 16 weeks. We have 4 courses, and we do 160 hours of outside rotation to clinical sites that we're contracted to. And we have a great passing rate for both our program and for the national certification. And if you have any questions at all, please email me at teresa.foster@tulsacc.edu.
Hi, my name is Professor Beth Tenney. I'm the Director of the Respiratory Care Program here at TCC. I also am a registered respiratory therapist. How about you? Would you like to become a respiratory therapist? Would you like fast-paced action? Would you like to have energy in a new day every day? Would you like to work beside the doctors and the nurses in ER, ICU? How about delivery? We often work with premature infants all the way up to the elderly when they're taking their last breath of life. That's what we do. We save lives. Aren't you interested? Don't you want to come see what we have? How about this? Maybe you're not liking a fast-paced action. Maybe you'd like a consistent. Well, we have that too. We have anything that you would like to do. There is something in respiratory therapy for you. Pulmonary rehab, pulmonary function testing, sleep lab, the ICU, ER. Come join us. Let us teach you the breath of life that saves lives, one breath at a time.
Hi, welcome to Veterinary Technology. I'm Dr. Jan Barnett. This is a unique medical program involving the skills of many allied health programs rolled into one. We provide nursing care for a wide variety of animals: horses, cattle, sheep, pigs, and goats, dogs and cats, our laboratory animals such as mice and rabbits, and our exotics such as birds, ferrets, and even fish. This is a degree program, Associate of Applied Science degree, and there are many careers available to graduates, such as industry representatives, private practice, government service, such as with the USDA, or even in the military. Our applications are online and open until April 30th for a fall start once each year. We hope you'll consider the Veterinary Technology program.
Hi, I'm Sandy Smith, Program Director for Health Information Technology. If you're interested in a career in healthcare, but you're not really sure about the hands-on patient care or having to handle all of those bodily fluids, then HIM is a good professional choice for you. We offer an associate degree leading to the Registered Health Information Technician credential, as well as our Coding and Reimbursement Specialist certificate leading to a coding credential. Our curriculum is going to provide you with a strong clinical background, as well as courses in coding, revenue cycle management, electronic health records, data analytics, compliance with privacy and security issues related to protected health information. Job opportunities are available in a wide variety of healthcare settings, including coding remotely from your home. We also have a variety of professional roles, including management, trauma registry, coding, and we serve as a solid foundation for related careers such as cancer registry. So please come to the breakout session and let's see if you belong in HIM.
If you're a student who's interested in the heart and all its vessels in the body, then you need to check out cardiovascular technology. You will work in a team-based environment with a physician, other healthcare workers, and a patient one at a time. Lots of technology, something to learn every day. Check out CVT.
Hi, my name is Andrew England. I am the Program Director for the Medical Laboratory Technician Program and Phlebotomy Program at Tulsa Community College. We're located on Southeast Campus, Building 8, and we're the only allied health program on Southeast Campus. We have two programs. We have the MLT Associate, which takes 2 years, and then we have the Phlebotomy Certificate, which can be completed in 1 semester. What a medical laboratory technician does is they perform laboratory tests in a clinical medical setting, most likely a hospital or a clinic or a doctor's office. So they're actually going to be performing the test on the samples and tissues to determine disease states. Okay? So what a phlebotomist does is a phlebotomist collects the samples, most likely blood draws, venipunctures, to send to the laboratory for the medical laboratory technicians to analyze to send to the appropriate healthcare practitioner to diagnose disease. The MLT program associate is what's called a 1+1 program, and that means that you get your prerequisites done your first year, and then you apply for the program and you're accepted into your second year, and all of your second year is just MLT classes, and then once you're accepted, the program only runs 11 months. The phlebotomy program is run every semester, including the summers, and so it just takes 1 semester to complete. The MLT program, we accept students every year in the summer to start the following fall. Since we're only a 1-year program, we accept 20 to 24 MLT students. Phlebotomy, we accept 8 to 16 students a semester. Okay, so as you can see, we have a full lab on campus. We've got medical grade clinical analyzers, so we can do a lot of simulation on campus. Helps you prepare you for when you go out to clinical. So this is our MLT side, and our phlebotomy side is over here. We have some phlebotomy simulated arms so that we can practice venipunctures and venipunctures draws in a simulated environment. A little bit about the salary and placement ranges of our program. We have 100% job placement. The salary for new grads with just an associate is generally about $38,000. If you're going to do second or third shift, it generally will run over $40,000. Our job placement for phlebotomy is 100%, and that generally runs between $11 and $12 an hour. We will help you find a job. Our ASCP pass rates are over 95% first time for both programs, and these certifications that you can get when you complete our programs will allow you to work in all 50 states without having to obtain separate state licensures. So we hope you consider our programs. It's a great field to get into. The jobs are plentiful. And if you have any questions, you can contact me at andrew.england@tulsacc.edu, or my phone number is 918-595-8667.
If you're fascinated by the human body and enjoy working closely with patients, then sonography may be the field for you. Sonographers use hands-on technology to produce detailed images of blood flow and soft tissue inside our patients' bodies. We're part of a healthcare team that works closely with our patients and often make a difference. Sonographers enjoy a fast-paced work environment that combines a variety of duties with plenty of action. Our daily responsibilities are varied and engaging with our patients. At the DMS program at TCC, you'll be given the necessary tools to learn this cutting-edge field of medicine. So come on, are you ready to be a healthcare superhero? Consider the DMS program.
Congratulations on your decision to pursue a career in allied health. Occupational therapy is the perfect marriage between art and science, and you'll have the opportunity to work with individuals throughout the lifespan, from newborns all the way up to the late stages of life, and in areas that are of interest to them in terms of cultural spirituality. Occupational therapy is as endless as your creativity. Every day is a different day. You can work in a variety of settings, such as inpatient, hospitals, outpatient, and out into the community. Come check out our breakout session to learn more information. And again, congratulations.
So we have provided a lot of information for you this evening on all of our allied health programs. You can submit questions if you have questions at this time. We have, like I said earlier, we have a couple of advisors from Allied Health if you have questions about classes. There's a list of our programs in Allied Health. And you can also go to our TCC webpage and look at these programs more specifically. In career services, I'll tell you a little bit about services. We do offer a number of resources for students. A number of the allied health programs do require an interview to get into their program, so we do help with mock interviews. If you need to practice, please reach out to us. We do help with resumes, and we do help with career planning. So if you're really not undecided about what you want to do, we do career assessments that are matched up with occupations. And that kind of gives a person an idea of how you relate to the world of work. But you can see there our contact information. You can email us at careerservices@tulsacc.edu. You can call us at 918-595-7609. You can follow us on our Facebook page and our Instagram page. If you want to, you can make an appointment with one of us through Starfish as well.
And we weren't able to have any nursing faculty join us today, just availability, but we are going to drop the link to the nursing page in there as well. If you all have any questions about the nursing program, you can visit the page there.
There is a question about the dental hygiene program. They want to know, what is the ACT to get into the program? I know 20 is a must, but what is the range that normally is accepted? So I don't know if anyone can answer that.
I can answer that, David.
Okay, Marilyn.
And 20 is the minimum ACT, and I was looking up to see what it was last year. Give me just a second.
Sure.
Okay, so last year, the average ACT score of students that were admitted was a 23.61.
23.61. Thank you.
Does that answer the question, I hope?
I hope it does. I think it will.
I just sent the answer. Okay, I see that Hannah is asking a question about the dental hygienist program and occupational therapy program.
Correct.
So I believe Penny posted her information. And I can post some information about the dental hygiene program as well.
Okay, great. Yeah, it looks like the answer you gave, Marilyn, about the ACT was right on.
David, I don't know if you can see the question that was posted for OTA, but if you're able to see it and read it to me, I'm happy to answer. I'm not able to find it.
Okay. At the moment, I do not see anything specific for the OTA program, even though someone is asking more information about the OTA program, just in general.
We had another ACT score question for radiography.
Can someone answer that question about ACT scores for radiography?
Yes, I believe the current cutoff score for the ACT for radiography is 20 or 18, I'm sorry, but let me double check that for just a second.
Okay.
I don't think they have a minimum, but they do use the ACT scores, math and science, and the composite scores for their rankings. So the better the score, the more competitive they are in the ranking.
For radiography?
Yes.
It's 18 and the minimum GPA is 2.8, and I will post the link to all the degree requirements here. That is a new addition though to the website. Okay, so that link should be available for everyone here in the chat.
Yeah, thanks, Katie. There is another question. Will there be help on getting jobs for respiratory care and medical lab tech? And what are the salaries?
I will say, as far as job placement after graduating the programs, part of it as you're finishing out as a student in the program, you're building those connections and you're working on site for like a clinical type internship type. So those connections are made pretty easily. I know Beth Tenney has talked about for respiratory that they are placed pretty easily. And for MLT, Drew England also is able to help with that. That is something that he will provide as well with job placement. And you asked for salaries. Give me just a second. Let me compare those real quick.
I just posted the link to our career services page, so we can help students prepare for their interviews, help them with their resume. And also in our Focus 2 career tool, you can research the average salary by occupation, both in Oklahoma and also in other states as well.
Thanks, Laura. Another question I have, are all the due dates for the applications listed online? And do the applications cost anything?
I can speak to that as well. Yes, they're all online. I know with Vet Tech, they do like those to be submitted in person, and maybe Marilyn could give some more information about that. But there are no current application fees for any of these program applications either. So they're, especially with everything virtual or online, things like nursing may require you to do a checklist with an academic advisor, but we can still do all those things virtually and upload the documents on the website.
Great, thank you. Another question on the radiation therapist, how competitive is it? What is the ACT range that applies? And last time I looked, it was around 70,000.
So our program is radiography, not necessarily radiation therapists. And I know that that program is very competitive. The radiography program is very competitive. And the ACT range, there is no minimum, but you can, the higher your ACT, the better application, competitive your application. Let me see, last year, they do encourage a 22 or higher on the ACT. Last year, it ranged from 17 to 31. That's quite a range, but there is no minimum requirement for radiography for the ACT. And I don't know about the salaries. That would be a career services question.
Yes, it would. Do we have any more questions? Let's see here. Okay, we have a question for respiratory care and medical lab tech. If I was to move out of Oklahoma, do I have to take the exams again in that state?
I don't know the answer to that. I don't know, Penny or Amy, Megan, do any of you know the answers to that?
I am not with either of those programs. I'm with DMS. I can tell you for DMS, it's a national exam and you do not have to take the exam again if you move out of Oklahoma. But I don't know about the other two areas.
Marilyn, and I concur with Amy. I'm not quite sure about the other disciplines, but I know for OT, you take a national exam as well, and you get licensed in each state, but you do not have to take the exam again in other states.
That would be a good question to email those particular program directors. It's Beth Tenney and Andrew England, and they're always welcoming to talk to students about more specific questions. And I was going to mention too, in case someone was wondering, you can apply to multiple programs. And it is good to have like a different one in mind, you know, kind of have different ones that you're looking at as you gather more information for, but there isn't necessarily a limit to how many programs you can apply to. And if you didn't get in the first year, meeting with an academic advisor to kind of do some planning on how to enhance your application. And for these programs, you could apply the following year if that's something someone would want to pursue further.
Thank you for that. Someone is asking, will there be another session like this one for nursing?
We don't currently have one scheduled. We do have a program, Pathways to Nursing, which talks about our transfer degree to eventually obtain a bachelor's of nursing degree. And we have a number of our partner institutions that will be at that presentation. But we won't have another majors fair like this, but you can definitely reach out to the nursing faculty and they can provide you with information.
We also have a Nursing Smart Start that will have an online version very shortly. We had an live session last week, and there will be an online version, should be coming out by the end of this week. So you can check the tulsacc.edu/nursing, and when that is available, the information will, the link will appear there that you can get more information about the nursing program.
Great. Someone is also asking, after completing the program and not being accepted into the program, what is the next step or steps for trying again?
My first suggestion would be to visit with your assigned academic advisor, because all the allied health and nursing advisors are trained in trying to help you be more competitive for the program and analyzing your account and seeing what you could do to improve your standing.
David, can I add to that response as well?
Sure, go Penny.
So for occupational therapy, I truly enjoy meeting with every single student who is either interested in our program or is wanting to apply to the program. And the one thing I've learned over the years after meeting with students is sometimes we discover that there is a match for maybe a different career in allied health, or maybe they may find occupational therapy more suited for them and not occupational therapy assistant. But I can help you navigate through those things. Sometimes childcare providers, early childhood development, or teaching sometimes is an overlapping career as well, and I can help you navigate through that. So if it's specific to OT or you're applying to PT and you just want to know the differences and the nuance between them, I am happy to meet with you. So you can also, I'm probably stepping just a little over, but you can also email program directors too and ask them specific questions, and they may be able to advise you as well.
Great, great, thank you.
Thanks, Penny. And thank you, Marilyn, for mentioning our Smart Start program. So for any students that are interested in applying to any of our allied health programs or our nursing programs, lots of these questions that you are asking will be answered in those sessions. So definitely, it's kind of like a mini orientation for our allied health programs and our nursing program. So be sure to watch for that.
Good questions. Please be sure to if you, after the day's session, please don't hesitate to contact these program directors specifically, because you may have some questions after today. Okay, I think that's all the questions we have so far, and I'm going to close it out. We want to thank the three presenters that were live with us today, Penny and Megan and Amy. And we want to thank Student Live for helping out with our virtual majors fair and all the staff involved. Thank you, everybody, and have a good evening.